Hi, I'm Louie Gohmert, lowly legislator from Texas, and I'm here with a very dear friend, Paul Gosar from Arizona, another Congress member, and we are fortunate to be again this evening with Scott Barbour, MD. Dr. Barbour has been an amazing and courageous physician. He just has. In this last year where we've been dealing with COVID-19, this person who has 5 clinics, surgery center, he has really been a forerunner in the area of orthopedics. He's also been a forerunner when it comes to treated COVID-19. Back a year ago, he began noticing some things. And Dr. Barbour, I'd like for you to tell folks exactly what got you interested in trying to find some way to deal with COVID-19 so that it didn't shut down all of your clinics and surgery center.
Yeah, well, Congressman Gohmert, thanks so much for having me. I always enjoyed talking to you about this, and I appreciate you giving me a platform to be able to share some of my observations. And just so the listeners out there know, I'm just a community doctor doing what doctors do. I gather information. I learn new information about medicine that's pertinent to the well-being of my patients, and I try to communicate that information to them and help my patients make decisions about their own health care. And you and I have discussed that a year ago, I would say December of 19, I started hearing something about some sort of illness that was going around China. And because I do own a surgery center, it got me thinking about preparing for obtaining PPE, so masks and gowns. And I knew that I got a lot of equipment from China. And so I went to the head of my surgery center and I said, hey, listen, I hear there's something going on in China. Let's kind of plan ahead just in case there are issues with obtaining the things that we normally get. And so I started paying attention to it. And then, of course, we all know COVID rolled out at the beginning of 2020. And because I have 5 clinics, I have close to 200 employees now. And I was responsible for my staff, myself, my family, my patients. And there was a pandemic that was potentially affecting planet Earth. So I started educating myself. And one of the first things I came across was hydroxychloroquine. And I started reading about it. And I'm familiar with hydroxychloroquine. It's a medication that's commonly used for prophylaxis against malaria. It's used to treat some inflammatory conditions in orthopedics. So I'm familiar with the drug. And I was also familiar with coronavirus. I mean, it's a virus that's a family of viruses, been around for a long time. When I was in medical school, I learned about it. And I thought it was odd that the news kept presenting it as the novel coronavirus. It was almost like they're trying to create an issue there that didn't exist. And, you know, being a doctor, I was a little bit confused. Like, is it me? Do I not know something that's going on? Why do they keep saying novel coronavirus? So at this point, I started going through the numbers myself. You could go to various websites. I was going to Worldometer, and you could go and actually look at the patients that were being affected by this disease in Italy, in South Korea. And I went through myself. I did what most doctors would do, which is I started looking at the ages of the patients. I was looking at the outcomes, looking at the comorbid conditions, and it became very obvious very early on in 2020 that this coronavirus was a virus that was primarily affecting older people in their 70s and 80s with comorbid conditions, and that young, healthy people were largely unaffected by the disease. And this is important because, you know, we have what we call influenza-like viruses that come around every year, whether it's the flu virus or the coronavirus or paramyxovirus or rhinoviruses that cause what we call the flu. And I know that we've all had that experience where we really felt under the weather. We maybe went to CVS to get a flu test and it came back negative, and you thought, man, I could have sworn I had the flu. I really feel like I have it. Well, you probably did. You just had a coronavirus or a paramyxovirus or something that wasn't influenza virus, but commonly causes these diseases. And so I thought that was great news when I learned that older folks with comorbid conditions were largely the people being affected, and that younger people seemed to be immune. And, understanding this was a time when the Royal College of London came out and told us to expect a 3.4% mortality rate, which I thought was completely irresponsible when they said it, because it was clear that they were taking the sick people that were admitted to the hospital and using that as their denominator, and then the people who died, and then that's the mortality rate they came up with. But clearly, they knew that lots of people were out there that weren't being counted as being affected, that were, asymptomatic or not sick enough to go to the hospital. And I really thought to myself, I even said in my head, are you guys kidding me? Are you trying to create a panic? Well, we now know that, yes, that's exactly what they were trying to do, was create a panic. So I started to also learn about hydroxychloroquine. I know the medication is safe, and I started hearing things in the news about how dangerous hydroxychloroquine was, and that it was cardiotoxic and all these things. And I'm thinking to myself, what are you talking about? Well, if you have a teenage kid that went abroad on a mission trip to an area that was known to be affected with malaria, they probably took hydroxychloroquine as prophylaxis, and nobody ever got EKGs or tested them for cardiac issues, because the medicine has been FDA approved for 65 years. It's literally one of the safest medications available. And yet all this information started coming up that it was somehow dangerous. And there became more and more people telling us, no, it's dangerous. And I started to think to myself, why are you preventing me as a physician? Why are you making it difficult for me to prescribe this very safe medication? I mean, if you're not my patient, it's really none of your business. So why were they getting involved in this?
Well, Dr. Barbour, why do you think that this information started being pushed out, that HCQ was so dangerous and that it should not be used for people with COVID-19 symptoms? Why do you think that ever got started? I mean, I know, but like in Texas and other places, medical boards were threatening doctors if they actually prescribed that for people with COVID-19. Where do you think that came from?
Well, there's a couple of reasons. Number one, we know that Big Pharma has a financial stake in not having a 65-year generic medicine, 65-year FDA-approved safe generic cheap medication that would basically eliminate the need for anything else. And we've seen that at the same time they're telling us that hydroxychloroquine is dangerous. It's a lie, and we know it's a lie. They're allowing us to use remdesivir, which is a medication that costs $3,120 for a 5-day dose, and our hospital systems are using it without any question whatsoever. And there's one dubious study that shows that remdesivir shortens your stay in the hospital. It doesn't even decrease mortality. And yet we use that medicine. Nobody ever complains about there not being any, large body of evidence or a large number of studies to support it. And then in the very same breath, we can't use a 65-year FDA approved medication that we give to pregnant women, we give to children. We never did any screening, and there's more. When President Trump was, I don't know for certain, but I'm sure he was being briefed by people. He clearly mentioned that hydroxychloroquine was maybe effective. He made that statement at a time that I was saying to myself, as just a regular citizen reading available literature, yeah, it does look like it's effective. Well, the stock of Gilead Pharmaceuticals dropped $21 billion as soon as he made that statement.
Wow.
And then suddenly the New England Journal of Medicine and the Lancet, the number 1 and 2 medical journals on planet Earth, came out with studies saying that hydroxychloroquine was dangerous, cardiotoxic. Those studies had to be retracted 2 weeks later when they were caught using fake, phony data. And it turns out that the company that did this, Surgisphere, had ties to Gilead. Now, I'm always telling people, listen, there's no reason for politics to get into our medicine, and you don't have to connect the dots the way I do. But it is a fact that the number 1 and 2 medical journals, the New England Journal of Medicine and the Lancet on planet Earth, published fake, phony studies on hydroxychloroquine that had to be retracted when they were caught. That's a fact. Now, on the heels of those studies, the FDA came in and essentially banned the use of hydroxychloroquine. Hospital systems to this day still don't allow, many of them still don't allow their physicians to prescribe hydroxychloroquine, despite the fact that there have been a lot of research supporting that hydroxychloroquine is effective. There have been no widespread efforts to let the public know that this very safe, long used medication that's very cheap might be effective to prevent them. And, my question is, why is this? And yet we're getting pushed a vaccine that was rushed through, that's had many problems. I know my colleagues and I are still wanting to see the data on this. There's been very limited human trials. And, it's interesting too, the way politics has gotten into our medical system. It's really quite disturbing.
Really
you
is.
can almost tell somebody's politics based on how they feel about masks and hydroxychloroquine. And, I went to the hospital not long ago to do a surgery, and the anesthesiologist asked me if I had gotten my vaccine. And, he knows who I am and I know who he is. And I looked at him, I said, I haven't. And he kind of asked me, well, why not? And I said, why would I take an experimental vaccine for a disease that has almost no chance of hurting me? And I asked him, were you aware that the New England Journal of Medicine and the Lancet had to retract fake studies on hydroxychloroquine? And he wasn't.
Well, let me ask you, you mentioned politics, and the president did suggest that, it might be a helpful treatment. I've talked to him about it. And you got to know, he didn't come up with that on his own. He's not a doctor, but he talks to a lot of really terrific doctors. And that's where he heard it. People talked like, oh, gee, the president's not a doctor, and he came up with this crazy idea. He didn't come up with it. He just talked to very good doctors that suggested it might be helpful. But Paul Gosar, I think, as you know, doctor, is also a doctor, a dentist, and quite good one at that. And he's been studied in medicine. And Paul Gosar, our friend Paul, your thoughts, questions?
Well, Scott, a lot of this has to do with the CDC, NIH, and FDA, and it's the emergency use authorization. And so when a material covers that, like hydroxychloroquine could, then you don't get the research money rebound that they were looking at. But they knew about hydroxychloroquine because of its actions of how it utilizes and helps penetration of zinc into the cell, making it more antiviral, and then also reducing a lot of the inflammation. So my question to you is I think this should be pursued, don't you? Because, think of all the people that could have been saved. Like in Taiwan, 23 million people, and as of today, 9 deaths, no healthcare workers whatsoever. Venezuela, did the same thing, 1,300. But this compares to tens of thousands in our country.
Yeah, to be honest with you, the research is legion. The more over the 2020, the more I researched hydroxychloroquine, the more I heard on the news that we don't know anything about this and that we need more randomized, controlled, prospective studies on it. The more I'm saying to myself, are you kidding me? There's a ton of research on this stuff. Absolutely. And there's more than enough information for me to feel very comfortable prescribing it to my patients. And guess what? I've come across people who've gotten sick over 2020. I've treated every single one of them with hydroxychloroquine and zinc, and every one of them has recovered without incident. Now, I'm not making an assertion that they all recovered because I prescribed hydroxychloroquine. I'm just making the statement that there's literature out there to tell me that hydroxychloroquine is likely effective at preventing COVID, and I've used it effectively. And I haven't had any untoward effects using it, which is what the literature tells me. It's a very safe medication. And the funny thing was, when I really started peeling back the layers of this supposed cardiotoxicity, I talked to my friends who are cardiologists, and it turns out that in the 65 years that hydroxychloroquine has been FDA approved, they have not had one single death, not one, billions and billions of doses, not one single death attributed to hydroxychloroquine in the doses that we would prescribe for COVID. I mean, that is truly amazing. It doesn't get any safer than that.
Right, and it matches the pharmacological reasoning that you ought to be prescribing it.
Yeah. So,
absolutely. And the scarier part is there were governors that were using these fake phony studies in the New England Journal of Medicine and the Lancet as a predicate to be able to ban the use in their states. And there were doctors who wanted to prescribe it, but they were afraid of the FDA agents that were being repurposed against these doctors who were prescribing hydroxychloroquine and pharmacists who were willing to fulfill these prescriptions. And they were basically, there was an active effort to prevent people from using hydroxychloroquine, and it worked.
Yeah.
Well, so you probably weren't surprised when the American Journal of Medicine now came out and said, gee, we have learned that there are studies that indicate this hydroxychloroquine, azithromycin, and zinc actually are proved effective in keeping people out of hospitals.
Yeah, it's kind of interesting. I noticed Dr. Simone Gold, who is a very brave physician. She's the head of America's Frontline Doctors. And she very courageously got people like me and others together to say, hey, we need to let the world know what we know about hydroxychloroquine, that there's a lot of information about it. And she's been referred to on social media platforms as a known purveyor of misinformation. And I'm thinking to myself, are we now going to refer to the New England Journal of Medicine as Twitter and Facebook going to now put a label on the New England Journal of Medicine and Lancet as known purveyors of misinformation and apologize to Dr. Simone Gold? I mean, when is that going to happen? She lost her job over this. She was fired from her job. And this is really the reason that I'm willing to speak out and why I'm, you said I've been operating all day. I've been on other conference calls, and I'm willing to do this because I just want to have the ability to be able to talk about this. I mean, regardless of what my medical opinions are, it shouldn't be a crime for me to discuss them. And doctors, we have disagreements about lots of things. I've been thinking a lot about this comment that we make, you hear it all the time, best practices. Best practices is a term that people have creeped into the American lexicon to prevent dissent. There's no such thing as best practices in medicine. Each individual patient is an individual, and when a doctor gets to know that particular patient, those circumstances are very unique. And there's no bureaucracy of best practices that can control the way we treat our patients, and we should not allow it.
Well, so one more intrusion of the federal government into the doctor-patient relationship.
Yep.
And the doctor knows best, not the government.
Yeah, and I don't know if you guys are aware that right at the end of 2020, there was a master's degree person in charge of the Department of Economics at the Johns Hopkins University who went on the CDC website, and she started noticing that if you compare the death totals in 2020, that it was really not much different from 2019, 2018, 2017, 2016. And she also noticed that there was obviously an increase in deaths attributed to COVID-19, but ironically or not very funny, deaths attributable to other causes like heart disease and pulmonary diseases and influenza, those seem to drop away completely. And so she put that study out there, or it wasn't even really a study, it was just a compilation of the statistics. And that was retracted about a week after it was released. And the reason for the retraction wasn't that the data was poor or that it was wrong or that it wasn't calculated properly. It was that people were using the information in an irresponsible manner. When have we ever prevented people from spreading truthful information because the public doesn't have the ability to use it? I mean, we are living in crazy times. And like I said, people have got to be willing to stand up in a crowded room and say, no, there are only two genders. That's a fact.
Well, with regard to this treatment, though, unfortunately, it wasn't just a matter of, maybe it works, maybe it doesn't. There were people that were dying that never even got to find out if hydroxychloroquine, azithromycin, zinc might have helped them. And that is a real tragedy. And you mentioned Dr. Gold. I know that she linked up patients with doctors that were authorized to practice medicine in those areas so that they could be checked to see if they could get hydroxychloroquine. And I know in Texas, it was not initially a medical board, it was the pharmaceutical board that were threatening to go after medical licenses for using it. But fortunately, there was enough pressure brought to bear by people that were smarter or less political than they were that said, this is insane. And so they backed off. But, it was shortly after the inauguration, the CDC director said that schools can open safely without teachers being vaccinated. What do you think the long-term effects of these school shutdowns for a year will be?
Thank God my kids, I live in the state of Georgia, and so my kids have been back in school for a long time, and they go to a private school, but they still have limitations. They've been missing their sports. They've been missing their extracurricular activities, all of those things that make us who we are. I think about who I am today was made in the things that interested me when I was a kid. Missing a penalty shot to lose the state championship in soccer was an experience I had that made me who I am today. And I'm thinking of the kids today that are, missing proms and missing out on dates and missing the ability to interact and go to band and orchestra and play sports. And, I think about the Rutgers basketball team. They finally made it into the NC2A. That's gone forever. Those kids will never get that opportunity back. And the sad thing is, we know it's not based in science. These lockdowns are ridiculous, and so are the masks. Listen, we have been affected by influenza-like illnesses for decades that we've been aware of. We have been studying masks forever, and not until 2020 have we ever thought that wearing basically anything on my face would have something to do with the transmission of these diseases. And yet I still have to go into a restaurant, put a mask on and wear it to my table, take it off, eat, and then I got to put it on to leave, and I got to act like this is normal. And it just isn't. I still go into the hospital doing this mask game, and it's a hospital. And I'm looking around like, why are you people going along with this? And I mean, we could do an entire show on the psychology of why people are behaving the way they are.
Well, and it is confusing for those that have trusted Dr. Fauci. Originally, he said, you don't need a mask. And then he said, yeah, you need a mask. And now he's saying probably be better off with multiple masks. But it reminded me of Winston Churchill's quote, people have heard of Keynesian economics. Yeah. And Winston Churchill, who disagreed with his type of economics, but he had seen Keynes change his opinion, much like Dr. Fauci did repeatedly. And he said, if you put two economists in a room, you will have three opinions, unless, of course, one of them is Dr. Keynes, in which case there will be an unlimited number of opinions. And so it seems like that's kind of where we are currently, whether it's the CDC or Dr. Fauci. And it just seems to me that patients are better off listening to their own doctor that examines them and recommends to them. Doesn't that make sense?
Yeah, I mean, one of the most important things I learned in medical school was that every patient is unique and that you can't help a patient until you lay hands on them. And I learned that lesson every single day, where I really come across a different patient who's got something that's so unique about them that changes my thoughts about how to treat them. And a lot of it has to do with my perspective on life and quality of life and my risk tolerance. And I have to communicate that to patients who have different perspectives on that. And one of the ways that patients are able to get adequate information to be able to make life-altering and sometimes life-saving decisions is by getting information from lots of different people. You go to one doctor, they give you the information from their perspective. You can go to multiple doctors, and that helps you make opinions. I mean, gosh, when I get my engine fixed at a car, I get 2 or 3 estimates to kind of get an idea about what's going on. And, it's funny, in economics, we're allowed to have 3 different opinions, with 2 different economists, but in medicine, we're supposed to have best practices. I mean, this has really just gotten so out of control. And the other thing is, why is it that for me to prescribe hydroxychloroquine, 65 years, the FDA approved, one of the safest profiles of any medication around, and yet I'm constantly beaten over the head with getting more studies, but I have to wear a mask, and you can't produce a single study that shows me that masks prevent the transmission of influenza-like illnesses in vivo. I mean, if you look at any of the research that they use to advocate for masks, it's always, the mask will prevent the virus from traveling as far, droplet size, or all these different things. But when you actually look at it, if people wear masks, do they actually stop the spread of disease? No, there's nothing that shows that. So why can't we talk about it? I mean, if somebody wants to change my mind, but don't just mandate I have to wear a mask.
Yeah. Well,
control.
Thank God we've had very courageous physicians over the years. Most people don't realize that a lot of medical historians say it was 100 years ago, around 100 years ago, when for the first time in human history that you had a better chance of getting well after seeing a doctor than getting worse. And thank God that there have been physicians over those years that have been able to stand up and go, I'm not sure that's a good idea. I mean, I think about George Washington and Dr. Craik, C-R-A-I-K. He was Washington's dear friend. They were deep, dear friends. And we know that Craik did the last bleeding. He may have done the last 2 bleedings of Washington. And at the time, they couldn't understand. They were getting rid of all this bad blood. He should have gotten well. But some doctors began to say along the way, I'm not sure we're helping our patients by doing this. So thankfully, and I'm sure they were criticized at the time. Wait, we know this is what everybody does. They didn't have a CDC back then or medical boards to do what they've done on HCQ. But I appreciate your courage, and I appreciate your intellectual approach to these things. Paul, do you have any closing comments as well?
Yeah, I thank the doctor for honoring his Hippocratic oath and to do no harm and to look out for his patients. But I also think that we need to hold the FDA, the CDC, and the NIH accountable, because how many people could have been saved? How much of a hit to our economy could have been deterred if it wasn't for the emergency use authorization of a drug that would have predisposed not doing or paying for vaccines, remdesivir, whatever you want to talk about. That's what's sad about here. And now we're learning more and more about this acquired adaptivity study that was originated out of the United States and its relationship with COVID-19. So I got to tell you, we need to hold government accountable. But thank you so much, Dr. Scott.
Dr. Barbour, last comments for a couple of minutes here. We wrap up.
Yeah, I would just like to tell people that they really need to get involved and understand just how far gone our medical system is. The ability of a doctor to offer advice and to treat a patient has been severely infringed. And sometime we should do a show on all the tools that they use to prevent doctors from treating people during this pandemic. And thank God COVID wasn't nearly, I know they got numbers 500,000, but the reality is this disease was not nearly what they said it was. And someday history will unravel what's been done. But there have been a lot of courageous doctors out there. Dr. Gold, who actually made it possible for citizens who live in states where their governors were preventing access to hydroxychloroquine for them to be able to get it. And people should government has been and how much they've inserted themselves between doctors and patients.
Really tragic. And also like to thank our friend Sean Hannity that's encouraged these podcasts and posts them on his website, and his producer Linda, and our help in putting this together, Lauren and Don. Thank you all for your help. And for those that are watching, God bless you, and may God keep you until we see each other again. Thank you so much.
God bless.